story isn't a typical story, to be honest. And when Gail asked me, I sort of thought, well, really, you know, is it relevant? But here I am, and I've been asked to tell it. So I'm going to give you a little bit of backstory, really, because it's highly relevant. So I have worked, or had worked, in NHS pathology laboratories for 44 years before my retirement in 2015. I'd worked in haematology for 40 of those years. And I had seen literally hundreds and hundreds of patients with CLL and every other sort of haematological malignancy as well. My role for the last 20 years was as the haematology services manager. So I was responsible for all the haematology testing, blood transfusion, anticoagulant services, a nursing team, but I was also responsible for the haematology, oncology, clinical trials portfolio. So it was my job to set up new trials in the trust and make sure that the right people went in them. So unlike most lab managers, I had a really big clinical role. And I attended MDTs, which is where all the experts get together, and participated in the discussions about possible treatment options, how fit people were, whether or not they were suitable for a trial, what sort of treatment. And my role on that meeting was to make sure that the right people had the opportunity to go into a clinical trial if they wanted to. Because for the NHS, it's actually probably the only way that patients get access to the best and the latest, well, best, we don't know, but the latest treatments. And one of the last things I did before I left work was to set up the FLAIR trial at my own hospital. So my role also involved looking at blood smears, making a diagnosis of leukemia, looking at bone marrows and all sorts of different things. Some of you will have had a diagnosis that was made incidentally, and I have seen more people like that than I care to count, really. Feeling a bit tired, got a lump in my neck, tonsils are swollen, something like that. Look down the microscope. Okay, we've got CLL. I love looking at all those cells down the microscope and deciding what they might be. And then it was my job then to order the extra tests to make the diagnosis a certainty, to tell the GPs, make sure they referred people onto the haematology team and stuff like that. My own CLL story started on a Wednesday in June 2013. I had a lot of bruises for quite a while, probably 3 weeks, a month or something like that. Big ones, small ones, all the rest of it. And my consultant haematologist colleagues had started to comment. I was like, oh, hang on, we are colleagues. I am not your patient. We are colleagues. Back off, essentially. Okay? I really did brush their concerns aside, although by the time I got my diagnosis, I had my own concerns because I've got this little lump here in my neck and I've got all these bruises, but I ignored it. That strategy had done me very well for nearly 60 years. Ignore whatever it is, stay away from doctors, stay away from hospitals, and you'll be all right. However, so one morning, this Wednesday morning, we were having coffee about 7:30 in the morning, and I've got a big bruise here. Strange place for a bruise, really, but still. One of the consultants came in, and no pleasantries, really, that morning. Just took one look at me, went out again. Okay. Came back with the blood test form that we're all familiar with, handed it over to me and said, you need to get this done. Not perhaps you should anymore, which was what had been discussed before, but you now need to get this done. I thought, I've got to get this woman off my back. So I knew she was right, really, but I was still slightly, you know, I walked down one end of the row of labs and got one of my nurses to take my blood. And that was a process I hated. We all come to terms with it in the end, but I absolutely hated it because when we were younger, when we were learning how to do it, or we were teaching other people, people used to practice on us. So I had more blood taken in my early years than most people, and normally it wasn't an easy process. It was like what we used to call it knitting. So what are you doing knitting in that patient's arm or person's arm, you know, bodging around. So anyway, blood in hand, I went at the other end of the lab and spoke to the member of staff who'd been working all night and asked him to run it through the analyzer. And we both stood there. I was quite calm. I stood there waiting for the results to come up on the screen from the analyzer. And when they came up and I looked at them, I knew instantly what it was. And of course, instantly, I knew everything about what it was. And the floor fell away. That whole thing about fight or flight, whatever, came in, and I walked away. I didn't say a word, I just walked away. I went back into my office, and I literally walked around in circles. And I just thought, okay. This is serious. This is one I can't ignore now. But I still didn't say anything to anybody. I went out into the hospital grounds and I just walked around. It was a beautiful day. The birds were singing and I sat down. It all seemed extremely surreal. That feeling of not quite being on the floor, that your head is somewhere else and everything else. So the important bit, really, about my CL at that point was that my platelet count was 23. Not a good number. I went back to my office. My colleague appeared, my consultant colleague, and she'd been called back from the clinic by my lab staff. And suddenly we were playing a game that had been fun before, but was now deadly serious, okay? And that is the game of, if you had so-and-so wrong with you, who would you want to go and see? Because you know who the good, the bad, and the absolutely terrible are for any disease. So all of a sudden it was like, oh, who do you want to see? Who do you want as your doctor? Well, that wasn't such a hard decision in the end, because I knew all the consultants in the region. I'd been to meetings with them, I'd had conversations with them about different patients and this and that and the other, and I chose somebody who didn't work in my hospital. I didn't want to be seen by my own team. And I chose this doctor in this hospital, one, because they got the biggest cohort of CLL patients in the area, so lots and lots of experience. And I chose this doctor because he was knowledgeable, he wasn't too old, he wasn't too young, but most of all, he was a really good human being. And I knew he cared about his patients, and I wanted him to care about me and what happened to me. My colleague made a phone call, and I went home and I went to see him the next day. And as I knew he would be, he couldn't have been kinder. He could not have been kinder. And for the benefit of my husband, who knows nothing about CLL or any other sort of leukemia, he treated me exactly the same as any other new patient. Gave him the leaflets and everything else. I knew I was going to need a bone marrow. And having seen hundreds of patients have bone marrows, I was not looking forward to that. I was quite scared. And he was kind enough to arrange it for that very morning. So I didn't have to go home, I didn't have to wait and get even more anxious about it. And I had an amnesic drug. And he said, oh, you won't know anything about it, it'll be fine. I'm like, oh, okay. Anyway, apparently I kept saying, can I just tell you I'm not asleep yet? Can I just tell you I'm not asleep? And because he hadn't explained to me, you don't go to sleep. It just makes you feel a bit stupid, really. Apparently it's very disinhibiting. He didn't tell me anything else I said, but I don't think I really want to know. But anyway, I'm not asleep, I'm not asleep. He rang me later to confirm what we both had expected was that I had got ITP associated with my CLL. And ITP stands for idiopathic, although it wasn't idiopathic, thrombocytopenic purpura. Now, about 5 to 10% of patients will get ITP. I was one of the lucky ones. I mean, whether I was lucky or not, I don't know. I mean, I could have gone for years more and not known I'd got CLL, really. My bone marrow was making plenty of platelets, but the rogue antibodies produced by my CLL were mopping them all up and killing them all off. So, because my platelet count was so low, he wanted to give me steroids, and I refused. And he wasn't happy. My doctor was not a happy bunny. That thing about mania, well, I'm manic enough, really. I didn't need that. I said, I don't want steroids. He said, I don't want to give you steroids. But he said, okay, we'll watch it for a bit. Because I knew that some cases of ITP will resolve on their own. And I also knew that it was unusual for people who got ITP to bleed in their head. But that was the big danger. Was I going to have a massive bleed in my head? And that was scary. So I had to go back 2 or 3 times a week for about 3 weeks until we started to see, we were just getting to the point where I was thinking, oh, I'm going to have these steroids. But we just started to see an increase, slowly, they went from 23 to 28 to 32. Yay, 32, you know, and then after that it started to rise exponentially. That weekend of my diagnosis, all my consultant colleagues came to visit me at home. Well, I thought I was going to die. I seriously thought I was going to die. And I looked at each of them and I said, am I going to be all right? And they all looked at me. And there was no answer coming back. Because, of course, they can't give you an answer whether or not you're going to be all right. But at that time, that felt like a death sentence to me. And I was very, very upset, to say the least. Everybody at work knew, because, of course, it goes around very quickly. And so on Monday, I went back to work. I thought, well, I'm probably safer here than sitting at home on my own. I've got all these consultants around me and hospital and everything else. So I'd asked for my genetic testing to be done, and then I got the news I was in 11q minus. Not so good, but could be worse. But knowing that, I knew it wouldn't be long before I needed some treatment. I wasn't going to be one of these people who had 20 years of watch your weight, sadly. So I used the time to really, I think, come to terms with it. Acceptance was a huge part of starting to feel better about it, really. Acceptance that all the things I was hoping for, seeing my children get married and and things like this, may not have happened anyway, you know, that they might not want to do that. And just accepting where I was and what was happening at that moment in time. At that time, FCR was the only treatment that was really available to me, unless I went in this trial that, of course, I'd already set up at my own hospital. And that was what I decided to do. I had 2 years of research and decided when the time came for treatment that I was going to enter the FLAIR trial. I waited too long before I decided to have some treatment. Probably 6 months before, they were saying we really need to get going now, and I thought, oh no, I feel all right. I feel okay, I can wait. Because for me, once the treatment started, I felt like my own time clock would start to tick, really. No, I'm fine. And I waited too long. So I would say don't wait too long. You need to feel well going into it so that you don't feel rubbish all the way through it. I was lucky enough to get ibrutinib and rituximab. And I say lucky because there's 11q, I'm probably unmutated as well. And so FCR is not always, you can't say forever, but it's not always the best treatment for people who are mutated. My lymph nodes disappeared in a week. It was absolutely miraculous. I thought I would lose 3 stone as my lymph nodes and liver and spleen and everything melted, and that unfortunately didn't happen. I did have had side effects, and at times I felt pretty grim, I have to say. Arthralgia is probably the most debilitating thing because literally there have been days when I haven't been able to use my hands. But not once did I not take those tablets. Not once, because I knew how important it was to take the full dose every single day. I had really bad hypertension, ended up in hospital with my blood pressure at 240, I think it was over 70 or something like that. But that's now well controlled. The arthralgia has diminished over time, and to be honest now I hardly have it 3.5 years later. And I hope that the ibrutinib will continue to work for me very well for many, many years to come. If you looked at my blood test, you wouldn't know I'd got CLL now. And that really is a little bit of ibrutinib magic, isn't it? Okay, that's me.